So type 1s definitely can follow the low carbohydrate lifestyle to achieve better control of blood glucose. How about fasting? I mean, we are the low carb and fasting. I'm a big promoter of fasting myself. I practice fasting myself, and I know you also do. Tell us more about fasting for specifically type 1s.
Well, as most people with type 1 know, there are certain parts of the day when you are less responsive to your insulin because other things are going on in the background. So, for example, a lot of people in the mornings get a cortisol spike or an adrenaline spike, which is called the dawn effect. And that sometimes requires additional small units of rapid acting insulin to correct that. And it makes sense to avoid food for several hours at a time, so you don't put the stress on your body with respect to carbohydrate ingestion. Even if you're low carb, you can still get away with 2 meals a day, which I do, and I eat in about an 8-hour window ideally. Of course, like everyone else, I'm human and slip from time to time, but I try to avoid breakfast and have a late lunch and then reasonably early sort of evening meal, so I finish everything by 8 o'clock. So between 2 and 8 o'clock I'll eat my set number of calories, if you like, and 2 meals without any snacks. And of course it's very beneficial. So it increases insulin sensitivity. It promotes this phenomenon called autophagy or autophagy, where the body is good at self-repair. So it helps reduce inflammation a lot. So I think there's a lot to be said for it. And certainly if you're low carb, it's dead easy. If you're high carb, it's much more difficult because of the sheer high volumes of insulin, and you may need to add corrections by eating sort of at least glucose as form of snacks if you've got it wrong. Although some people can manage a high carbohydrate diet quite well. About 10% of people can manage a high carbohydrate diet to the levels that people on a keto diet can manage, whereas 90% of people on a keto diet can manage their blood glucose almost to the normal range. So it's much more advantageous to go keto, in my view.